Assalamu alaikum. Let's talk about physeal or growth plate fracture. The growth plate or physis is composed primarily of cartilaginous tissue and is responsible for longitudinal growth of bone. Classification of physeal fracture are categorized anatomically by Salter-Harris classification. It is divided into five parts: Type 1 across growth plate, Type 2 growth plate and metaphysis, Type 3 growth plate and epiphysis, Type 4 growth plate, metaphysis and epiphysis. Type 5 is compression fracture of the growth plate. Type 5 is the compression fracture of the growth plate. Type 1 is least severe, Type 5 is most severe. Clinical presentation: focal pain, swelling, tenderness at the fracture site. Focal pain, swelling, and tenderness at the fracture site. Diagnosis: mm, X-ray of the growth plate fracture for type 1 to type 4 shows fracture line through the physis. Management: type 1 to 2 are extracellular fracture, typically be treated with close reduction and casting, and type 3 and 4 intra-articular fracture that usually require open reduction and internal fixation. Type 5 fracture are generally treated with casting and patients should be non-weight bearing. These fractures are often diagnosed in retrospect in a patient with a growth arrest of the involved bone because of subtype is challenging to diagnose with initial X-ray. What is its prognosis? A prompt treatment reduces the risk of long-term complication. However, any injury to the growth plate, particularly with compression fracture type 5, can cause premature growth arrest and lead to persistent limb length discrepancy. So that is all about physeal or growth plate fracture, and this is the very important Salter-Harris classification.